we are ready to start. I have my colleague Natalie from TDRA who will continue to help me um, with letting people into our webinar space. I am just going to put up the slide and make sure that everyone is able to see. Does it look okay?
Yeah.
Perfect. So good afternoon. Hello, and thank you for joining us for this very, very exciting panel that is presented by the Alzheimer Society of Toronto, the Center for Addiction and Mental Health, and the Toronto Dementia Research Alliance. Today's panel marks Alzheimer's Awareness Month and will explore brain stimulation therapies, their uses, risks, benefits, and the latest research updates. We will also be discussing opportunities for participation and hear insights from a research participant's perspective. A little bit of housekeeping. We will definitely welcome audience questions towards the end, but feel free to type your questions in the chat throughout the session. I am going to ask that everyone keep themselves muted. This event will be recorded and posted on both the TDRA YouTube channel as well as the AST YouTube channel for later viewing. And because it is recorded, I will ask that if you are posting any questions in the chat, just to make sure that you do not provide any private information. In terms of what you can expect from today, this is our agenda. So we will have introductions, an overview presentation to brain stimulation. We will also have a moderated panel discussion, and then you'll be able to ask your questions and have closing remarks. Today's session is moderated by myself, so I am Julie, and I am the Senior Manager of Education and Community Programs at AST. I also have a colleague of mine moderating with me, so I'd like to introduce Natalie, and Natalie is the Knowledge Translation Specialist at the Toronto Dementia Research Alliance. For those who are not familiar with the Alzheimer Society of Toronto, I wanted to provide you with a little bit of an overview. The Alzheimer Society of Toronto, or we call ourselves AST, we provide information, education, and support to people living with dementia, their family and friends, healthcare professionals, as well as the general public living within the M postal code. We service all dementias, and diagnosis is not required to access any of our programs and services. Our services are offered in person as well as virtually through Zoom and the ALS Educate e-learning platform. To learn more, please visit our new website at www.alz.to and take a look at all the exciting events for our upcoming offerings. I'd like to tell you a little bit about our partner, the TDRA. The TDRA, or the Toronto Dementia Research Alliance, was established in 2012. It's a collaboration between the University of Toronto and 6 major hospitals in the GTA. You can see their logos along the bottom of the slide here. TDRA's goal is to better understand, prevent, and treat dementia. They connect scientific research with real-world care, improve education and outreach in the community, and make it easier for researchers to work across the city. TDRA also invests in research and training to support the next generation of dementia scientists and clinicians. I'd like to now hand it to my partner, Natalie.
Great, thanks, Julie. So as part of our education and community outreach, AST and TDRA created a research study section on the Toronto Dementia Network, or the TDN. This section lists dementia studies open for participation in Toronto at TDRA partner sites. All the studies are led by TDRA affiliated scientists. They're approved by what's called a research ethics board, and everything is explained in simple terms. You can connect directly with the study teams to express interest, and you'll find out that way if you're eligible. There are studies for people with dementia, mild cognitive impairment, those at risk for dementia, caregivers, and healthy volunteers. And for more information, you can visit the website shown here in orange or via the QR code that's on the slide. I will also drop the website in the chat box as we go, so you can check it out. We can move to the next slide. Okay, and this is what the website looks like. So to find studies, you use the search bar at the top. You can type in a keyword. So for example, Alzheimer's disease. You can apply filters, or you can do both to narrow down your search. Or you can use the quick search buttons in the blue boxes. And if you're not sure where to start, you can fill out a questionnaire and someone will help match you to a study. To do this, you click the orange button that says Match Me to a Study. And today's topic is brain stimulation. So if we can move to the next slide. Oh, I think one slide backwards. Oh, yes. Okay, sorry. We'll stay on this one. So on the TDN, you can search brain stimulation and you'll find that there are 7 active studies across Toronto at our partner hospital sites. So each study summary explains what the study is about, who can participate, the location, and the time commitment. Again, that's all in plain language for you and your understanding. And I think that's it for TDN. We'll move to the next slide. Okay, we're grateful to be joined by 3 exceptional panelists today, each of them bringing thoughtful and unique insights. So we have Dr. Mina Mirjalili, a postdoctoral fellow at the Center for Addiction and Mental Health, who specializes in personalized brain stimulation techniques that are aimed at improving brain function. We also have Dr. Luca Pisterzi, who's the Vice President of Research at the Alzheimer Society of Canada, who focuses on translating research into practical solutions that enhance the quality of life for those affected by dementia. And we also have Vince Pankuska, who brings valuable perspectives through his lived experience with mild cognitive impairment, caregiving for someone with dementia, and participation in clinical research at CAMH. We'll also have Dr. Sanjeev Kumar from CAMH joining us later as a clinical expert, and he will be able to help answer any questions that you might have. Okay, so first we're going to welcome Dr. Mirjalili, who will provide an overview of brain stimulation and specifically its applications for dementia. So welcome, Dr. Mirjalili.
Thank you, Natalie. I can share my screen to show some slides. Can you see my slides?
Yes, we can.
Okay. Again, thank you, Natalie, for the introduction, and hello, everyone. My name is Mina, and I'm happy to be here to present on brain stimulation and dementia. As Natalie mentioned, I'm at Center for Addiction and Mental Health, CAMH, where we do a lot of brain stimulation studies. But first, I'm going to talk a little bit more about dementia itself. Dementia is an umbrella term that shows a progressive cognitive decline, severe enough to interfere with daily life and independence. It's not a specific disease, but it's a group of symptoms caused by various brain disorders. It has some key features. First, cognitive decline. Dementia affects memory, language, problem solving, and attention. Also, dementia results in functional deficits. It interferes with daily activities like cooking or managing finances. And also, it prevents individuals to do those kinds of activity independently. And finally, it's a progressive and symptoms get worsen over time. Unfortunately, I have seen this firsthand as my grandfather is also struggling with dementia, and I've seen directly how ugly this disease can be and how progressive the symptoms can be and how significant it is. Dementia can be caused by various disorders. One of them is neurodegenerative disorder. These disorders damage destroy brain cells and brain parts. One example is Alzheimer's disease, which is the most common cause of dementia. As you can see in this picture, it clearly shows the difference between a healthy brain and a severe Alzheimer's disease, and how severe Alzheimer's can destroy different parts of the brain. Other type of neurodegenerative disorders are Lewy body dementia and frontotemporal dementia. Lewy body dementia, it's when specific chemicals are built up in the brain, and it mostly affects memory, movement, and also sleep. Frontotemporal dementia mostly affects the language part of the brain and the language function. In addition to neurodegenerative disorders, we can also have vascular dementia, where the problem is with the brain and blood vessels, and blood won't flow naturally to the brain. So we will have reduced blood flow to the brain, and this would cause dementia. There's also some other causes of dementia, which they're not very specific. And they, yeah, and I'm going to skip it. In Canada, every hour, more than 17 people develop dementia. By 2030, we expect to have 1 million people with dementia. And this number grows fast because of our aging population. So by 2050, 1.7 million people could live with dementia in Canada. Unfortunately, when the symptoms of dementia become evident, it might be late to intervene to stop the progression. So it's best to focus on preventative strategies, especially in high-risk population, including mild cognitive impairment or depression, because it has been shown that these populations are at high risk of developing dementia in future. Brain stimulation has shown promising results in improving cognitive function or depressive symptoms in these populations. But what is brain stimulation? So when our brain cells get activated, they release some chemicals, which results in generating electric signals. And different areas of the brain are communicating together through these electric signals. Brain stimulation can intervene with these communication. It uses a gentle electric or magnetic signals to help certain parts of the brain work better together. It has two main types. The first one is non-invasive. It doesn't need surgery. We only place a special cap or a device or a headband on the head, as you can see in this figure. We also have invasive methods, which they require surgery. We need to place small electrodes inside the brain. The invasive methods is usually used for Parkinson's disease when they try to treat the symptoms related to Parkinson's disease, for example, the tremor or movement disorders, and it has shown very good and significant results. How does brain stimulation work? So it can boost brain's activity. As I mentioned, it can make different parts of the brain interact with each other better, and that makes their connection stronger. So this can help brain rewire itself by encouraging its natural ability to change and adapt, which is called plasticity. This is like when we try to exercise and we are exercising a muscle. It gets stronger when we use it more. And this is the same concept with brain stimulation. It can also regulate the brain when it's overactive. It can help balance the activity. It can help balance the activity of the brain. Brain stimulation has shown promising results in improving memory symptoms, especially in high-risk population, for example, depressed people or people with mild cognitive impairment. It can help brain cells to communicate better, and it can slows down the memory problems or the memory decline over time. In people who are experiencing depression, it can help improve the depressive symptoms. For example, it can reduce feelings of sadness or lack of interest. And also, it's a drug-free option. It shows very significant and positive outcomes in depressed people who are resistant to treatments with medication. So it can be an alternative for patients who are treatment resistant to medication. So let's look at an example of brain stimulation effectiveness in a project that led by our team. So we have tested 143 males and 232 females. And these participants were diagnosed with mild cognitive impairment or remitted a major depression. And this study took place over 5 hospitals in Ontario. So patients were split to 2 groups. One receiving cognitive exercises with brain stimulation, and one group receiving placebo. It was like fake brain stimulation and not very hard cognitive exercises that challenges the brain. Then we compare these 2 groups for 6 years. So we measured their cognitive functions over 6 years. And the group who received active stimulation, active brain stimulation, showed slower cognitive decline through time in this upper line, active group, compared to the group who received placebo or sham stimulation in the lower line. So this study was promising in showing that brain stimulation was tolerable and effective in older adults. Despite its positive effects, brain stimulation has some challenges. First, it's not a cure. It can help with the symptoms, for example, with mild cognitive impairment or depression, but it doesn't stop or reverse the disease. Also, in terms of accessibility, brain stimulation is clinically approved for depression and Parkinson's disease in Ontario. But for cognitive functions and dementia, it will be only administered in research settings through a research study. So you will only get brain stimulation in research hospitals. And in terms of side effect, it has some potential side effects. Although there is no reported long-lasting side effects for brain stimulation, but patients have experienced headaches, discomfort, or pain under the electrodes where we apply the brain stimulation. There are some rare cases that participants were experiencing seeing flashes of lights during the stimulation. This was especially happening when we had brain stimulation very close to the eye. And also in some rare cases, it can start seizure. So we don't recommend brain stimulation to people who have experience of seizure or epilepsy. And finally, brain stimulation is not for everyone. As I mentioned in dementia, it works best in early stages or moderate stages of the disease. Also because it's...
Hi, Paolo. Sorry to bug you, but I'm trying to
Sorry about that. You'll have to unmute yourself again, Dr. or Mina. I had to mute everyone.
Can you hear me?
Yes.
Oh, great. Okay, so I'll continue. So yeah, I was telling that because brain stimulation in dementia is administered in research settings, individuals need to be eligible to participate in specific studies. Each trial and study has its own inclusion and exclusion criteria for participation. So individuals need to meet those inclusion criteria to be able to receive brain stimulation. Also, research has shown some variability in terms of response to brain stimulation. Brain stimulation can be very effective for one person, but it can be not very effective or not effective at all for another person. So depending on the individual, there is a variability in the results of the brain stimulation. In terms of the current research, at CAMH, we have a wide range of studies using brain stimulation for a wide range of populations, including healthy adults, depression, mild cognitive impairment, and other diagnoses. One specific study that I'm working on and I'm very excited about is where we try to improve the efficacy of brain stimulation by personalizing brain stimulation. So here the idea is to test if we can improve the efficacy of brain stimulation and reduce the variability across participants by tailoring the brain stimulation parameters to each person's unique brain activity and structure. So first we get the data from brain structure of the participant, then we analyze the data from brain activity, then we integrate both and tailor the brain stimulation. For example, we change the location of the brain stimulation, or we change the amount of current that we apply to the brain so that we can increase the efficacy. In this study, we target patients with mild cognitive impairment, and our focus is to improve their cognitive functions through brain stimulation. So if you want to participate in one of these studies, as I mentioned, there are a lot of clinical trials going on in different research hospitals in Ontario. You can the website of Toronto Dementia Network to find out about different studies, and also simply you can reach out to us and we can find you the study that's best for you. Like we need a wide range of populations, including healthy adults, mild cognitive impairment, depression, and some others population where you can find them in the website. Also, if you're wondering why you should join and why to join in a clinical trial, well, it can help advance the science. We can learn more how the brain works, how to stop the symptoms of dementia or other brain disorders. And also you will have the opportunity to get access to the cutting edge technologies that we use at CAMH and other hospitals. And with that, I'd like to conclude my presentation and thank you all for your attention.
Thank you so much for that presentation. It was lovely for us to learn what you meant by brain stimulation. I would like to now invite our panel, which is made up of Luca, Vince, as well as Mina, just to stay and answer a few questions before we move on to the audience questions. I'm just gonna give me 1 second to make sure I've pinned everyone. Okay, my first question is going to be for Mina. So my question for you is the effect of brain stimulation cumulative and permanent, or do people have to continue with the treatment to maintain the results that you're seeing? And do these treatments need to have ongoing healthcare provider monitoring to make sure that it's safe and effective?
Yeah, that's yeah. So the effect of current brain stimulation paradigms is not permanent. So we need booster sessions to be able to keep the effect. Although there are some new technologies proposed that we can reduce the number of sessions that the participant needs to come in and receive the brain stimulation, so we can pack a lot of sessions into one session, but still we need booster sessions. Also in the study that I mentioned during my presentation through that 6 years, we had booster sessions every 6 months to maintain the effect, and we've shown that it is effective to have like some boosting sessions. In terms of supervision of healthcare providers, the studies that we are doing at CAMH, we ask participants to come in and we apply the brain stimulation, like some trained staff, research staff who knows how the brain stimulation works, how the device works, to make sure that it's tolerable, it's safe for the participants. And also we have our medical investigator who can make sure that if any side effects happens, they're aware and they can help the patients and participants. Although I'm aware of some studies who are using remote-based brain stimulations, they're mostly in US. I'm not very sure about their protocols, how they do it, but I'm sure that there are some remote supervisions or some training sessions for participants to make sure that they can use the brain stimulation in a way that it's supposed to be used, and like they ensure the safety. But at CAMH, we use it with the supervision of our staff.
Okay, great. Thank you. This next question is for Luca. So Can you speak to what some of the main challenges in implementing brain stimulation technologies within the Canadian healthcare system? And also, if you could speak to that in terms of the long-term care home context.
Yeah. Thank you, Julie, and thanks for that really exciting presentation, Mina. It's really, really interesting work. I think the challenge remains access on the whole. Typically, when we think of the Canadian health system, it's currently, I think it's safe to say that it's stretched. But we're looking for ways to be creative to increase access. And I think treatments like there are various, I see in the chat, there's chatter about different kinds of brain stimulation. I see ECT, TMS. I think Dr. Mirjalili talked about TDCS, which is a type of current stimulation. I think the more research we can get in to get these treatments approved and drive access, that will help both in the community and in long-term care.
Great. Thank you so much. And this question is for Vince. So my question for you is, how did you first become involved in brain stimulation research? And what would your advice be, or what advice would you give to someone who is thinking about joining similar studies like brain stimulation? You'll need to unmute, Vince. Can't hear you yet.
Vince, along the bottom.
Oh, okay, I see.
Okay.
Okay, do you hear me now? So
We hear you
about
now.
6 years ago, I have seen advertisement looking for participant in research of memory study. It was done in CAMH. I participated. There were no stimulation, but there were exercises using computer software like Happy Neurons, and it did go for 4 years, mostly home, once a month at CAMH, and every 6 months there was cognitive impairment assessment done at CAMH. Now I was already somewhere in record, so last year I was contacted if I would be interested to participate in this further study using brain stimulation. I did go now. I had experience by looking people. My late wife had dementia, and so if I had chance to learn something more and do something, I gladly participated. So I did go there. We have done very detailed cognitive impairment assessment. There was a stimulation for 10 days going there, and again assessment. So as the research goes, there is always measure, do, measure. So we have done assessment, do some stimulation and trying to compare it, and months later it was done again. Assessment, I mean. Now, if I would recommend to, there was no pain, no, well, only problem is to get from Mississauga to Toronto, so traveling time. But during actual stimulation, it was very friendly. Those participants were very nice. When I had some few questions, they were very friendly and very knowledgeable. So I recommend then I would say you can recommend to participate on two sides. One, you help advance the science of health, as Dr. Milgeri mentioned. And second, look at yourself. You learn something about your own, or how to judge when you see somebody from family or friends are having a problem with memory or maybe progressing dementia. So it is worthwhile to attend. And you get one message: be physically and mentally active. It was in different word mentioned by Dr. Mirjeli. So do it, and do it with your friends, do it with your family. Okay,
Thank you
next
so much.
question.
Thank you so much, Vince. And you brought up a great point that it's for yourself, but also helping the greater community understand how we can help future generations who also may be developing dementia. So I'd like to go back to Dr. Mirjali. So my question for you is, how does the use of technology and data help personalize brain stimulation for people with dementia? And how could it create treatments that do work better for every person?
Yeah, so I mentioned in my presentation, one of the studies that I'm working on is focusing on personalizing the brain stimulation. So research has shown us that we need to have some personalization in the brain stimulation to increase the efficacy. And for that, we don't start the brain stimulation right at the way in the first day, and we don't apply the same parameters for every participant. So we ask the participant to come in. We first do neuroimaging. We do MRI to get data about their brain structure. Then we ask participants to do some cognitive functions, and while they're doing that, we record their brain activity. So we get data from their brain activity too. Then we combine these two together to find out how we should tailor the brain stimulation parameters for that unique person. So someone was asking through the chat where we should do the stimulation. So research has shown us, like previous research from the animal studies or some other clinical studies has shown us some specific areas of the brain are more responsible, for example, for the memory or cognitive functions. For example, we know that the frontal area of the brain or the temporal part of, like on the side of the brain, are more responsible for memory, but we are not sure where exactly we should put the brain stimulation. These analyses beforehand, like using the MRI brain activity, can help us find out which specific location we should stimulate for each participant. And we're hoping that by using that, we can improve the efficacy, but other research has shown it that it can improve the efficacy, but we are also hoping to see the same results in our clinical trial.
Thank you. The next question I have is back to Luca. So my question is, how can the Alzheimer Society of Canada support the integration of new personalized treatments like brain stimulation into the mainstream dementia care, especially when we're talking about underserved areas or underserved communities?
That's great. Thanks for the question. So I think it goes back to if we look at the steps involved in getting a treatment from like the discovery phase or development and research through to making it available to the mainstream, there's one, you can make it available through clinical trials to a limited population while it's being tested. So the Alzheimer Society, through initiatives like the Toronto Dementia Network and also Pan-Canadian, we've got a database to help connect people to clinical trials. So there's some type of access there, albeit it's still in the trial phase. But in terms of rolling things out and increasing access to the mainstream community, I think one of the strongest roles the Alzheimer's Society can play is at the advocacy table. And there are a few ways we can do that. So for example, there are some medications that are currently under review by Health Canada for dementia, donanemab and lecanemab. These are treatments that are, currently being reviewed. The Alzheimer Society led the collection of input from people who may be impacted by the approval of these treatments to support the review process. So that's one way we can do advocacy. And in terms of the integration at the local level, healthcare is managed provincially, but we work closely with our provincial counterparts to make them aware of new treatments and to support some knowledge there and also to help drive advocacy. And the third point in terms of supporting underserved communities, that happens at the local level. We do our best to really try and connect with various communities. And we have highlighted actually these disparities in what's called the Landmark 2 report, The Many Faces of Dementia, which shows the projected increases and the disparities among different groups, different racialized groups, new immigrants, women. And so we're definitely zeroing in and highlighting the discrepancies among those communities and building relationships with them through our local societies, because the Alzheimer Society is a federated model, to really help support access and care. So there are multiple ways the Alzheimer Society gets involved in these types of support initiatives.
Great. Thank you so much, Luca. Vince, you talked about when you, as a participant, that you didn't find it very painful. So I'm just wondering if you can talk a little bit more about your experience of being a participant in a brain stimulation study. Some things for you to think about was the process intimidating or scary at all? How were the research staff? Did you have questions? Were they answered? Can you talk a little bit more about your experience?
Okay, I did not feel intimidated, for certainly. Those research coordinators, they did behave very nicely. When I had questions, they explained what they are doing. They put me that mask with 64 electrodes to measure. Then they show me how to put the stimulant device on my head. They explain they measure another signal coming from hand and how they are locating it. So it was really nice and useful. And as I said, I help with science, but I did learn something about myself. Now the discussion also helped in that I can recognize when Alzheimer's disease is coming, say family, and so where to advise to lose a specialist or trying to get people to geriatric specialist. So having that further more knowledge is helpful also that you can help other people. At the CAMH, it took it was not too long. It was adequate. No real problem. Okay.
Okay, thank you so much, Vince. So it sounded like your whole experience from beginning to end has been very pleasant, very helpful. And you brought up a good point about just getting more information makes it easier for you to advocate or speak up for yourself in the healthcare system and what your needs are. I'd love to thank our three panelists. I'm going to hand it off to Natalie just to help facilitate some of the questions that were coming up in the chat.
Thanks, Julie, and thanks to our panelists for all of your responses to those questions. We do have quite a few questions in the chat already. I saw that Dr. Sanjeev Kumar did join. So Dr. Kumar, if you do have responses that you'd like to chime up with, feel free to just unmute yourself. There's a lot of questions about the cost and insurance. So Dr. Mirjalili, you specified that brain stimulation is approved for depression clinically, but currently for dementia and cognitive disorders, it's just in research. So for either of those, are there costs associated or is it covered by insurance?
For research, there is no costs. They can just reach out to us, and if they're eligible to be participating in one of the studies, it's free of cost. For clinical depression, I'm not sure about the cost and insurance, but we do have some studies that focus on depression also, and that's also research and free of cost.
I can
And
confirm that for it's not it's covered limited. It's delivered in limited capacities at some of the major hospitals, but it's not generally reimbursed by OHIP yet for depression.
for depression. Okay.
Yep.
Great. And some people were wondering, I guess, for depression, if it's a treatment for depression with fewer side effects, why is it not recommended ahead of medications? If anyone had a response to that.
I can maybe start, and maybe Dr. Kumar, as a geriatric psychiatrist, can add. I think, like anything, it takes time. So if you're looking at, let's just consider depression, where there's a ton of evidence that shows something like TMS works and is effective. I think there's a longer history, just because we've had medications for longer, that you're the first kind of line of treatment for depression is antidepressants, and there are several on the market that are approved, and clinicians are very comfortable using them. Where TMS comes in, it's under the current recommendations, is that it's a second line treatment for major depressive disorder, when there's treatment resistance. So what does that mean? So that means someone has tried one type of medication and it hasn't helped them, and so then TMS becomes an option, but it's still currently mostly available as an out-of-pocket service. Did I get that right, Dr. Kumar?
You're on mute, Dr. Kumar.
Yes. Yeah, I was just saying yes, Luca, of course, you are right. So like different treatment options are sometimes in parallel, like different medications and other interventions. So some people benefit from medicines more, and there are pros and cons of either intervention. So and medicines are more established at the moment, even for depression. So I think that was the question, right? Why are they still used, right? So I think they will continue to be there, of course, as they're a valuable treatment option. But then with brain stimulation, these are additional options that are now becoming available.
Thank you, Luca and Dr. Kumar. There's some questions about your specific studies, Dr. Mirjalili. So how significant was the reduced decline in the experiment with 5 hospitals, 72 months? And the non-invasive procedure, how many times are the stimulation given?
Yeah, so it was statistically significant when we run some statistics, compared the active versus the placebo group. And also the figure also showed that there was a difference in terms of the cognitive decline. In terms of the number of sessions, for this study specifically, we had an acute phase where we applied stimulation for few days, repetitively, like consecutive days for a few days. And then after that, we had booster sessions. That was every 6 months for a week. Then we asked participants to come in for a week. They had some cognitive exercises. There was some team groups where they received brain stimulation, and also the cognitive exercises for a week every 6 months.
Thank you. There's a question about, so deep brain stimulation can sometimes be used for tremors and for forms of Parkinson's disease. They're asking, sometimes they have to have the battery pack in the person's chest changed with an implanted device. Is this the same for stimulation for depression and dementia?
For depression and dementia, we use a non-invasive brain stimulation. So we won't need any brain surgery or battery. We just apply some electrodes or device. It's like a coil on the head. And we do it at CAMH. So there is no need for a battery change or anything. It's with the deep brain stimulation, which is invasive, that requires those things.
Great, thank you. And maybe Dr. Kumar could answer this one. How do you determine mild cognitive impairment? As it seems it could be a subjective measure. How is that made objective?
You're on mute, Dr. Kumar.
Oh, sorry. So there are different sets of criteria to make the diagnosis, and we see if the person meets those criteria. Some of which include like if the person is independent in terms of function, so getting information from different sources and the whole assessment basically, and then to see if the person meets certain criteria.
Yeah. And questions about, I guess, outcomes of your research. How do you know if the brain stimulation is working? What kind of measures do you look at?
Yeah, so we do some cognitive tests at the baseline. We apply brain stimulation and intervention, and at the end, we repeat those cognitive tests to compare baseline versus after stimulation to see if the stimulation was effective or not.
Is there any combination of other stimulation? So, for example, puzzles or word search games that people can do?
Yeah, like in this study that I mentioned, we had brain stimulation plus cognitive exercises. Like those, there are specific exercises that was challenging enough for the participants to be able to engage their brain. And there were also some helps from a moderator to help them improve in those exercises. So yes, we did have those.
Thank you. Does CAMH have any research related to transcranial alternating current stimulation?
Yes, the study that I'm working on is
That is, yes. Okay. Great. Okay, I'm just going through the chat. Did the side effects from stimulation, so any side effects that can occur, do they show right away or later after the treatment?
For example, that seeing lights that I mentioned, it happens right away during the stimulation, or the pain under the electrodes can happen during the stimulation, but some things like headaches can remain with you like after the stimulation. But all those things are transient and it won't be long lasting.
I have one more question here. Why do some patients need invasive procedures? Does your study show how long brain stimulation delays dementia stages?
For the invasive, I think for Parkinson's disease, the brain area that's affected, it's very deep in the brain. And deep brain stimulation can help with that to stimulate specifically that area of the brain. And it shows very significant results. So I think people are eager to do like an invasive procedure to be able to reduce those symptoms like tremor. And what was the second question?
Does your study show how long brain stimulation delays the dementia stages? So I guess the progression.
Yeah, like in the study that I mentioned, we assessed participants through 6 years, and it showed slowing the cognitive decline. But it's true that we need more longitudinal studies or with longer follow-ups to be able to confirm the long-lasting effect of brain stimulation in terms of preventing the progression to dementia.
Thank you. And somebody is just wanting clarification on, is brain stimulation the same or different than ECT?
ECT is a brain stimulation, but it's different from the usual brain stimulation. With ECT, we are actually applying a controlled seizure to the brain. It's more intensive than, for example, something like TDCS or TMS. And that's used for only very severe depression. So it's a brain stimulation, but the intensity of the current that we apply to the brain is much more than brain stimulation techniques such as TMS or TDCS.
Thank you. We have 2 more questions here. Is there any legitimacy to gamma entertainment using sensory stimulation at 40 hertz?
This is very technical, like with like visual stimulation. But yeah, I can maybe take that offline to discuss more. I'm interested.
Sure. If the person who submitted this question wants to, I'll drop my email in the chat. You can email me and I'll connect with Dr. Mir Jalili for you. Okay. Is deep brain stimulation, will it be beneficial for Lewy body dementia since it helped with Parkinson's disease?
I'm not very sure. But yeah, maybe I can search for the studies if they've used deep brain stimulation for Lewy body dementia. I'm not sure.
Okay. Yeah.
So I can answer that. So maybe, so I don't think there is any evidence at the moment for Lewy body dementia, because the deep brain stimulation is approved for Parkinson, or is used for Parkinson for very specific movement problem. So that you install the electrodes and it helps with the movement part. So when it comes to dementia, maybe it's much more diffuse. So I'm not aware of any evidence so far for that.
Thank you, Dr. Kumar. And there's just one last question. Just wondering if these studies are Canada-wide or just for Ontario residents?
I think we have research hospitals Canada-wide, but the ones that we have in our website, Natalie, correct me if I'm wrong, but they're mostly in Ontario and Toronto.
Yes, correct. I'm not sure if eligibility dictates that you have to be an Ontario resident, but many of these studies would occur on site, so it would just make traveling to and from the actual location more difficult. But it's something you could definitely look into if there's studies you're interested in and you're not an Ontario resident. Okay, so I think we are at time. So thank you to our panelists for joining us and to everyone for attending and contributing to such an engaging discussion. And we have a brief post-event survey in the chat that Julie posted. If you could take a moment to fill it out, it would be really greatly appreciated. And as we said, the recording will be available on our YouTube channel in the coming weeks, and we can send out a notification when it's ready. So thank you to everyone again, and have a great afternoon. And Dr. Mir Jalili, thank you for answering all of those questions. Thank you.
Thank you.